Knock, knock.
Come in.
Hi there, my name is Anna. I'm going to be your nurse today. How are you doing?
I'm good, thank you. How are you?
Good, thank you. I'm just going to start by providing us with some privacy and comfort. And I'm going to do some hand hygiene. Today I'm going to be doing an abdominal assessment on you.
Okay.
This is going to require me to touch your abdomen a little bit. Does that sound okay?
Yeah, that's fine.
Okay, great. I'm just going to start by looking at your ID band real quick. And can you confirm with me your name and date of birth?
Olivia Poker, July 12, 2002.
Great, okay. So I'm going to start by just asking you a couple questions. Can you tell me where we are today?
The hospital.
Yes. And why are we here?
An abdominal assessment.
And then can you tell me what month it is?
February.
Great. So patient is ANO times 4, meaning she knows person, place, time, and situation. Do you have any allergies I need to be made aware of?
No.
No? Okay. And on a scale from 0 to 10, 10 being the worst, can you describe your pain for me today?
0.
Okay, great. So overall, patient looks like she has good hygiene, she's well dressed, she has good posture. Do you have any issues getting around at home? Okay, so mobility is good. So I can now begin my assessment. So just to start, I'm gonna have you lay back on your back. I'll just assist you. Great. And before I do anything, I'm just going to inspect your chest region. So basically, I'm just inspecting to make sure that that you are not in any acute distress in this position. And I can see that your chest is rising and falling at a slow and controlled rate. So because of that, you appear to be good in this position. So I will go ahead and continue with my abdominal assessment. So to begin, I'm just going to lift up your shirt. Does that sound okay? Okay. Lift this up and expose the abdominal area. In a real situation with a patient, I would have her remove this second shirt, but because this is just a video, I'm gonna leave the shirt on right now. Before I do anything, I'm just going to inspect the abdominal region. I'm looking at the skin integrity. The color of the skin is normal throughout. I don't see any scars or anything. No lumps or masses that I'm seeing just from looking. And everything looks good on inspection. So now that I've inspected, I'm going to auscultate the abdominal region. So I'm going to start in the right lower quadrant. And now I'm going to inspect the right upper quadrant. And I'm going to auscultate the left upper quadrant. And finally, the left lower quadrant. Okay, so when I'm auscultating, I'm listening for gurgling sounds and normal bowel sounds within the stomach. If I was not hearing any bowel sounds during my auscultation, I would continue to auscultate for a full minute to make sure I'm hearing those sounds, because if I'm not hearing those sounds, that could be an indication of something wrong going on within the abdomen. So now that I have auscultated and the patient has already identified that she is not in any pain, so that would mean it is okay for me to palpate the abdomen now. So again, once again, I'm going to start in the right lower quadrant. I'm going to palpate, and in this area of the stomach, or of the abdomen, I would find the appendix and part of the small intestine. And I'll move to the right upper quadrant, and this is where I would find the liver and gallbladder, and then the left upper quadrant, and this is where I would find the pancreas and the spleen. And are you feeling any tenderness while I'm palpating any of these areas? Okay, good. And then finally, the left lower quadrant. And this is where I would find the left ovary and part of the descending colon. And then I'm also going to auscultate the midline of the abdomen, just to make sure I'm not feeling any rigidity, no masses. I'm also not feeling any throbbing or anything like that within the abdomen. And the umbilicus is also in the midline with the body and feels good. Abdomen is flat, so all of that feels and looks as it should. So now I'm going to have the patient sit up, and then I'm going to turn this way. And now I am going to percuss the costal vertebral angle, and that's going to be right at the bottom of the ribs. So what I'm gonna do is I'm assessing for tenderness. So what I'm gonna do is I'm gonna gently, and are you feeling any tenderness or pain when I do that? Okay, I'm gonna do that on the other side. And no pain on this side. And if the patient was feeling any pain when I'm doing that, that could be a sign of an issue with the kidneys. But she's not feeling any pain, so that would be a normal finding. You can come back this way, and I'm going to document my findings, and you are all set.
Thank you.